A new bill to curb AI's role in denying health insurance claims is making its way through the state legislature. The bill calls for medical judgment cases to be reviewed by licensed medical professionals and not a computer algorithm. For more on this, we welcome Dr. Michael Dunn. He's board member of the Arizona Medical Association. Good to have you here. Welcome to Arizona Horizon.
Thanks for having me.
You bet. All right. So what is the relationship between AI and health insurance claims?
Well, increasingly, we're starting to see that insurance companies are using this artificial intelligence to review and in some cases deny healthcare claims and prior authorizations. They mostly deny that they're doing this, but the evidence is starting to be somewhat overwhelming that they are.
Can you spot a denial? Can you spot AI's footprint, so to speak?
Absolutely. Usually because the reasons for the denial are silly and they don't make a whole lot of sense. They don't follow good medical judgment.
Yeah. Can you give an example? Is there?
Well, we had one last week. A patient came in. It was an occupational injury. She was bit by a cat, and she needed to have the wound cleaned out. She needed a tetanus shot. And the insurance company, we, without getting into too much detail with the coding and stuff, but we build an appropriate level of code to get paid for the visit. Well, the insurance company sent back a denial, or what we call a down code, and they down coded it 2 levels, which represented probably $100 less in payment for us. And when we read through what their explanation was, it was very clear that it was a human had not reviewed that.
Yeah, was it kind of gobbledygook? I mean, was that kind of?
It wasn't gobbledygook, but it just didn't make sense.
Yeah.
If you understood the case and what had gone on.
Okay, so the bill that we're talking about here, this basically ensures that what claims aren't arbitrarily denied by AI?
That's right. It doesn't prevent the insurance companies from using AI. I mean, AI is great. We use it. It has lots of potential in healthcare. But what it does is it keeps the insurance company from using it exclusively. If they're going to deny a claim or if they are going to prevent a pre-authorization, then it has to be reviewed by a human.
When you mention pre-authorization, what exactly are you talking about?
Well, a lot of more expensive, more entailed medical procedures need to be pre-authorized by the insurance company. Basically, they'll review the claim and say that, yes, this is an appropriate treatment plan for the patient, or no, it's not. But they need to give you a reason. And oftentimes, when AI is involved, the reasons don't make a whole lot of sense.
Yeah, yeah. So the bill, if I'm correct here, no AI for reviewing or denying claims on its own. There's got to be some sort of human hanging around somewhere.
Correct, correct. Yeah, they're perfectly able to use the AI to screen the claims, but somebody has to sign off on it, and someone has to be responsible, preferably somebody that knows what they're talking about.
Yeah, a medical professional. AMA is backing the bill. Is this pretty much unanimous at the AMA?
Yes, I haven't encountered anybody that has opposed this bill. In fact, all of the major healthcare groups in Arizona support it. The Nurses Association, the Hospital Association, a number of them are supporting it.
I saw that where it poses a serious risk to patient safety, at least those who agree with you and are against this idea. How exactly does it pose a serious risk to safety?
Well, as an example, the Kaiser Family Foundation reviewed some claims from 2023. These were Accountable Care Act claims, and the insurance companies are responsible to submit this information to the government. What they found was that 1 in 5 in-network claims was denied, and nearly 2 out of 5 out-of-network claims were denied. And of the 72 million claims that were in-network denied, only 1% of them were appealed, which means that the care wasn't paid for. It also means that any follow-on care most likely was not provided to the patients.
And yet, I know what people that support the idea of using AI in all situations is that it streamlines bureaucracy, it makes decisions faster, it makes decisions cleaner, and in some ways better. Obviously, you don't think it makes the decisions better, but computer algorithms, these pattern-based computer algorithms, is there a place for that in health insurance, or is that simply too individualistic?
No, I think that they can use the algorithms, but keep in mind the algorithms are only as good as the data that's put into them.
Exactly. And that would be my next question.
Yeah.
If AI uses what's already there, what does that say about what's already there?
Well, it depends on who's programming the AI. So, and again, I believe there's a place for this, and the insurance companies certainly can use AI, and I would expect that they would. But at the end of the day, we need to protect our patients, and we need somebody that's qualified to review them before any health care is denied or before they prevent any prior authorizations.
Can claims that are rejected by AI, can the AI factor be used in protesting these claims?
I have not personally done that, and I appeal most of the claims that are rejected, and
Really?
that's not normal.
Yes.
It's a very expensive, tedious, and time-consuming process to appeal these claims, but generally I appeal them, especially if I think that we're in the right. Generally at a loss. It costs us more to appeal it than any type of money that I would stand to recoup. But in the future, that's possible. If this law were to be passed, and we truly believe that they
Yes.
didn't comply with the law, then absolutely that could be a factor.
Are you finding in this age of AI that you are appealing more?
Yes,
Really?
We're doing a lot more appealing than we ever have in the past, but we're also getting denied more often.
Yes, and that's thus the bill. Okay, the bill status unanimous, close to unanimous out of the House, right?
I believe we were unanimous out of the House, and it went through the Finance Committee, and nearly unanimous out of the Finance Committee, and we're hoping that it will sail through the rest of the Senate, and we'll be able to get it passed and get it on the governor's desk.
Okay, so it's still in the Senate, still waiting to move from there.
Correct.
My last question to you, and you kind of referred to this earlier, but maybe a little bit more here. What is the role of AI in healthcare in general and health insurance in particular?
Well, I believe that there's a lot of the administrative, the more tedious tasks that AI could take on. In fact, it already is. A lot of practices are using AI in the exam room to hear the interaction between the patient and the physician, and creating a very solid note about what that interaction was. And I expect that will only become more prevalent. It will make the provider's time more productive. Well, and even coding and billing. I mean, it's a great check to make sure that did we capture all the codes that we were entitled to capture? Did we code it correctly? Are there subcodes that we should add?
Right.
And AI is very good at that, but it's again, it's only as good as the data and the person programming it. And if there are ulterior motives in the data and the person programming it, it might come out a little bit different.
Dr. Michael Dunn, Arizona Medical Association. Good conversation. Good to have you here.